New today, the Biden campaign blaming Trump for the latest move by states to cut back on women's reproductive rights. The Louisiana State House passing a bill to classify abortion-inducing drugs as controlled dangerous substances. The Biden campaign warning this law is, quote, example of this dystopian agenda that Trump and his allies are pushing. Dr. Megan Ranney is joining us now to discuss. She's an emergency physician and dean of Yale's School of Public Health. Great to have you with us, Doctor. I just want to start with the fact that the risk of death with Mifepristone is lower than that of penicillin. So medically, why would it need to be classified as a controlled dangerous substance?
It doesn't. Not only is the risk of death less than penicillin, it's less than the risk of pregnancy. And let's be clear on what the Controlled Substances Act and this whole idea of scheduled drugs is about. It's about trying to unify federal drug laws to control medications that have high risk of addiction. Mifepristone and misoprostol in no way, shape, or form have any chance of causing addiction, substance use disorder, overdose, or any of the other things that all of the other medications under the Controlled Substance Act lead to. So this is pure legislative overreach that has nothing to do with the actual risk profile of the medications at hand. It's yet another example of legislators and politicians trying to get between women and physicians when it comes to allowing women to make the best choices for their own and their family's health.
Yeah, when we're talking about it, you say controlled substance, and it's like what you're talking about. You're thinking about narcotics, things like that, that are highly addictive, and this is just not proven to be that. A group of nearly 270 physicians, healthcare providers, medical students, all signed a letter to the bill's sponsor, Republican State Senator Thomas Presley, and they wrote in part, neither mifepristone nor misoprostol have been shown to have any potential for abuse, dependence, public health risk, nor high rates of adverse side effects. To your point, doctor, this drug has other uses outside of abortion. We do know that. I believe it can also be used sometimes in childbirth and in other situations. So how could it affect those who need this in other situations?
I and other public health professionals and physicians are worried that this is going to have a chilling effect on access to these medications. We use them to manage miscarriage, as you said. We use it to manage high-risk pregnancies, to manage postpartum hemorrhage, which is a leading cause of maternal death. Let's note that Louisiana already has one of the highest maternal death and maternal injury or morbidity rates in the country. It gets an F from the March of Dimes in terms of its infant and maternal health outcomes. This is going to put more regulations in place that will make these medications harder to access, particularly in rural areas or safety net hospitals, thereby putting many more women and children at risk of bad health outcomes.
And so much of Louisiana is serviced in rural areas, and they don't necessarily have great access to health care to begin with. Dr. Megan Ranney, thanks so much. We appreciate your expertise in this.